So thank you everyone for joining today. This is the November Cybersecurity Insider Program. And this month we're trying something a little bit different where obviously we're doing this on Microsoft Teams instead of GoToWebinar. And our goal for today is to hopefully make this interactive and give everyone the opportunity to ask questions of our panel and have a good discussion about cybersecurity. So I'm Laura Pursley. I'm the marketing director for CloudWave, and you're probably used to getting my emails, being part of the Insider program. You've seen my name quite a bit, so now you can put a face to a name. And on our panel today, we have Kelly Watson. She's the director of our Cybersecurity Tactical Operations Center. And we also have Guy McAllister, who is a cybersecurity consultant and performs the risk assessments and our C2M2 assessments. And Guy is also a former hospital CIO. And also joining our panel today, we have Patrick Neese. He's the CIO from Lake Regional Health System out of Osage Beach, Missouri. So thank you to all the panelists for joining us. Just to start the discussion today, I had sent out some emails asking for you to submit questions, and after every webinar that we have, we always ask for your input and challenges that you're having. So from that feedback, we were able to kind of put those questions into 4 different buckets. So we're going to start with these topics and have some discussions about these items, and then feel free to ask any other questions that you have related to cybersecurity. And you can either just jump in and ask the question, feel free to put it in the chat, or we can open it up at the end as well. So let's go ahead and jump right in. The first topic is artificial intelligence. And one of the questions that we received was asking about, what's the best way to manage challenges that are presented by AI? This is a fairly new thing for generative AI. It's making its way into healthcare specifically. So this question was around how to handle these adversarial and data poisoning attacks, specifically on medical device systems and use AI technology. So I'll open that up to the panel. Kelly, if you want to maybe jump in on that one first.
Sure. So it's a great question. So, managing basically some of the challenges that are presented by AI is going to be kind of an evolution of continuing to try to figure out how do we stay ahead of things. But really kind of in the context around potential adversarial and data poisoning attacks on medical device systems, I would say that there's not just kind of one approach. It's going to be this, kind of multifaceted approach of how we're going to take a look and strategize how we are staying ahead of this. So some suggestions I would have would really be around implementing, robust security measures that are going to adhere to the standards for AI systems and medical devices. This would include, I would say, encryption, secure communication protocols, and compliance with industry-specific regulations. Some other, things to start considering around is, regulatory or conducting regular scheduled audits and pen testing, really to help you start to identify the vulnerabilities in AI systems. This is taking more of that proactive approach and helping address the weaknesses before they become exploited. Also need to consider, if you're using third-party AI solutions, performing security assessments to evaluate really what's their level of maturity when it comes to their security measures. I would also say, ensure that the integrity and quality of the data being used and trained and operating AI systems, you have to really implement and, I would say implement measures to detect and mitigate data poisoning attacks, such as, you have anomaly detection algorithms, data validation processes. And last but not least, I think a lot of this is around user education, being able to educate and train your users, your developers. So I'm not sure if anybody out there is trying to develop their own AI tools, but education around the stakeholders about potential AI related threats and attacks. And just increasing that awareness is going to just foster that security conscious culture. And some other things, I guess, investing in a training program, potentially internal, start building your own internal expertise around AI security and risk management. Now, if anybody has
Okay.
anything to add to that.
And Laura, I would echo everything that Kelly just shared. First of all, if our focus needs to be on protecting our environment, period. Putting all the resources that we can in place to protect our information, our infrastructure, our organization from a cybersecurity standpoint. AI adds an additional challenge or wrinkle to that, but it is also a tool that we need to embrace because our clinical tools are beginning to embrace AI more and more. If we're developing AI within the organization, we need to make sure that we're monitoring access and coding and development of all of that so that we're aware. But those are just best practices that are already in place for cybersecurity awareness. So I would say make sure you're doing the very best you can be doing to protect your organization, period. And then we grow and learn as AI evolves and moves past its infancy that it's in today.
Okay, thanks, Guy. Patrick, do you have anything to share on what you're seeing with AI? Are you seeing this as a concern in your organization yet?
I would
And
say
what are you
it's
guys
a
talking
little
about?
premature, if you would. It's a buzzword more than anything here at this time. But, going off of what has been said already, protecting your medical devices, putting in things like network segmentation, having medical device assessments done before, you allow something like that on your network, making sure your perimeter's secure so these things can't not get in. Just continue to do the right things, and follow your cybersecurity program. But I think it's still questionable what is AI and how will it really be used in healthcare. But we don't need to take our focus off of the basics. So.
Okay, thank you. Does anyone have any other questions around AI for the panel? Anyone want to unmute themselves or jump in with any comments, questions, maybe share some things that you're doing as well?
I have a question, Laura. This is Jonathan.
Okay.
Have you seen AI used outside of a hospital where users are using ChatGPT or something similar to put in some patient conditions and question it for some ways to treat that patient? And what are your thoughts on that?
Jonathan, that's a great question. I'm going to jump in on that. We have actually gone and blocked all of the sites that we are aware of, like ChatGPT, just to prevent any kind of PHI leakage, unintentional or intentional. But these sites are, like you said, concerning, and we just can't have that kind of data exposed.
Yeah, and I believe there was a breach that did happen with that exact scenario where information was input and it was PHI that was input. I don't know if Kelly, if you have information on that or you know about that. That was, I can't remember if we did a TAC alert on that or not, but we have seen that has happened where PHI is being entered into ChatGPT, which is a HIPAA violation.
Correct. And so, I mean, I think that goes back to user education. So people aren't aware, what they can and what they can't be doing with ChatGPT. They simply are using it as almost a reference of like, oh, okay, I can get this information, but there's not really kind of these policies and procedures in place that I'm seeing that are truly being implemented with an organization to say, this is what you have to abide to if you are going to take advantage of using ChatGPT or any other source. So making sure that your data, again, that you're entering in there isn't something that is PHI or patient information. And yeah, I mean, so there's that level of sensitivity of ensuring that data that you put in is potentially could be used elsewhere, and exploited.
Absolutely. Any other questions about artificial intelligence? Okay. We did put out a policy and procedures document around AI, and I know a lot of you have asked for access to that, so I will send that out in the follow-up just so you can download that if you're interested in how to set up policies and procedures around AI for your organization. So we'll make that available to you. Okay, the next topic where we got a lot of questions was around medical device security. And a couple of these questions are very similar, but this first one is about struggling to get vendors to comply and then finding an easy and economical way to check all the medical devices in the hospital and how to check and identify those vulnerabilities, especially if you don't understand your current state. So I don't know, Guy, do you want to take that one first?
I'll start it and tee it up. I'm sure others will have insight as well. First of all, in struggling to get vendors to comply or understanding, medical devices now communicate with our EMRs just as other systems and servers do. And as a result, we as IT leaders and IT teams need to be informed about medical devices and the threats that they can pose and their vulnerabilities. And that information can be in different ways. For example, this forum, this CloudWave Cybersecurity Insider Program, is an excellent way to stay informed. CISA updates, their email alerts that you can check in on and understand medical devices and where they're touching. HHS's 405D task force has a website on cybersecurity, and they touch on mobile devices as well. But you want to inform yourself and then begin to build a coalition with your clinical engineering or biomedical team, as well as your supply chain or purchasing people that are involved in medical devices, even compliance, so that your compliance team, so you're creating an atmosphere within the organization that expects vendors of all devices, including medical devices, to collaborate and work with the organization around cybersecurity initiatives that need to be in place. You may even call that a governance team that meets and really in doing that, you're building a relationship with your clinical engineering department, and many of you may already have that in place. I know from my previous experience, Patrick, as a CIO, for a long time, biomed lived on one side of the tracks and IT lived on the other side of the tracks. And we didn't interact very much, and we didn't need to interact. But today, it's vital that there is a relationship, a healthy, positive relationship. Clinical engineering needs to be informed as to what cybersecurity risks are and how medical devices can play into that, because they may not have heard what's going on, and they may not know all of the details that we may know in IT. But build a relationship, and through your clinical engineering team, build a relationship with the vendors of medical devices, just as we built relationships with our EMR vendors and other key folks. I think that's important, and it really touches on several of these things: relationship building, informational sharing, collaboration.
Yeah, I agree with you. We've gone as far as to actually bring biomed up under the CIO myself here at the lake, and I think that's a trend probably most of you are seeing out there for many reasons, including cybersecurity. But there's so much technology now in these devices that it just makes more sense than being under the typical facilities kind of director role. I mentioned earlier a cybersecurity risk assessment on these devices as they come in. To perform one if you don't have one. CloudWave helped us put ours together. I'm happy to share it. There's nothing secret about it. But if you have a vendor that struggles with or will not complete your cybersecurity risk assessment, that's the first kind of alarm that goes off. You have to start talking to your clinicians. And as Guy mentioned, the best way to have that conversation is to get to know them first and maybe bring them into your cybersecurity governance so that they're learning with you and why you're doing the things that you're doing. So it's more than just the zeros and ones and the back end protection pieces, but also the communication and the education. And the last thing I'll mention, having an inventory is critical of what you have in your facility. And biomed, from my experience, they were not quite as accurate in the past. So really getting the biomed team to understand we have to have an inventory, not just we have this device, but we have this device, it's this model number, it's running this software, and treat it just like it was a PC in many ways. So.
Great, thanks, Patrick. Kelly, do you have anything to add on that topic?
Yeah, I mean, I guess just to echo what I think that I've seen a lot with the organizations that I've worked with, just following up to what Patrick just said, is the inventory. So it's, if you don't know what you don't have out there, then how can you be protecting it? And so it's the gathering of your medical device asset inventory is, I think, critical to start really implementing, the best practices around monitoring and protecting, and being able to run like vulnerability scans across your medical devices too is something that is important. So keeping that proactive approach instead of reactive approach, I think is very critical as well. And I don't know where it falls in line here, I guess, with, some of these questions, but I think just a general thing and shift or awareness that I've seen and participated in is that during incident response tabletops and drills that we conduct, we are often now seeing where, there's a shift in the sense of getting the biomed team, not only just the IT team, but getting your biomed team involved and saying kind of keep your IT team out of it. And for any of those who have listened on these meetings before, I'm sure that you've heard John speak of all the time of what our main focus is, and hopefully the shift in mindset around others is not focusing in on protecting the data, but it's protecting the patient. And so when you're thinking about medical devices and how if you hear about a medical device cybersecurity issue, you really should be thinking about, oh, what type of impact does that have on the patient? So that's just something, that I've seen where there's this general awareness and training and education around how important it is to have that collaboration between IT and biomed and others, because it's all integrated.
Yeah, thanks, Kelly. And I think that answers this last question of if your medical devices are not being considered in your cybersecurity program, everything you just mentioned are great steps to begin to include that in your cybersecurity strategy. No longer think of it as a separate thing and really start including it with those teams.
One other thing I'll mention, we've really plugged IT and biomed into all of our purchasing processes. And so, some of these things slip around and don't necessarily go through biomed to be bought. And, you have your surgery department and they decide they want this robot. But if you're not aware of what's coming, you need to find a way to insert yourself into that approval process. That way you ensure that those steps that everyone has talked about, begin to happen.
That's a great point. Does anyone else have any questions around medical device security that wants to jump on and unmute themselves and ask a question?
Now, I'll add one more thing, I guess, just for those that maybe are not aware, is, the development of specifically around medical device cybersecurity policies. So that I think is, something very important to make sure that there's, defined roles and responsibilities, access controls, procedures for when and who is monitoring and responding to security incidents involving these devices as well. So I think, that again, just the mindset has always been, oh, well, that might be potentially an IT thing, and that collaboration between if a medical device is having a cybersecurity incident, that communication has to be truly with, the people that are right there by the bedside working with the patient to understand what are we doing. So just creating medical device cybersecurity policies, procedures, and again, incorporating, the incident response around medical device incident response policies as well.
Absolutely. Thank you, Kelly.
Mhm.
I kind of probably have a loaded one here, but really looking at the space in, as the government, state and federal are starting to look hopefully more at cybersecurity incidences as almost like a FEMA, right? More money is getting put in. I heard about New York that's going to be putting a lot of money in over the next 10 years from the state as well into the cybersecurity landscape. And I'm wondering, as far as with medical devices, because there's so many medical devices. I mean, it costs $1.5 million, right? Some of this old equipment, it's really expensive. If there's any funding on the horizon that you all see in this area, because it's such a pain point, and I know it's kind of a loaded one. I know some has come out in some other areas, but I just wanted to see if you've heard of anything or anything coming down the pike. Because when working with that team and we all work together, one of the big things is, well, this equipment costs X amount, right? So you're trying to put a life cycle management program in place on this medical equipment, but some of it is just not only outdated, but it's $1.5 million to replace something.
Anyone on the panel, have you seen or anything around funding? I know you mentioned the New York. I think we are going to see states follow suit with more funding for cybersecurity specifically, and I think will remain to be seen what they designate that for, whether it's going to be very specific or more broad-based. I don't know, Guy, if you've seen anything come down.
I've not seen anything specific. I do think that we're seeing a growth in awareness at a federal level. Where I am, not so much at a state level yet, but some states are becoming more aware, and with awareness opens the door to funding, and so we can only hope for that. But the concern that was mentioned is very real, very legitimate, because these are not cheap devices, and we all know horror stories of some of these devices where $1 million is spent and they're running old OS, or things that we wouldn't let in the door normally. So we've got to get to a mature place where that doesn't occur. Putting dollars to that may help, but I also think some guidelines and regulations. And when it comes to healthcare, we're so regulated in many other ways. I'm old enough. You see the picture. I'm only a 30-year-old former CIO, so I just look like I'm in my mid-60s. But Patrick, you can laugh. The point I want to make is I remember the battle with medical devices was, well, the vendors would say, well, FDA says we can't put antivirus software on because we were approved without it. And it took the FDA to come out and say, that's not true. And the truth of the matter is we've got to put some regulations and some teeth behind this so that vendors are compliant and will work with us more helpfully than in the past.
And we're in conversations with the FDA to maybe present at one of these sessions next year, one of the maybe February or March. So that might be a good topic to ask them during that session as well.
I think it's really good points that got made. We really have to hold them accountable because these are, black boxes on our network. The only other thing I'll add to that is educating your board and your executive team on what these medical devices could potentially do to your environment. One example we had here recently, which you guys ladies know tons of examples, but our bedside monitors were extremely out of date. And, we just had to make a change. We could not afford that. And utilizing some of the events that happen in the world to help educate your board and your executive team as to this could happen to you if we don't make these changes, to try and get internal funding. I know that doesn't help from a federal or government, or state, but sometimes it helps drive it internally.
Thanks, Patrick. Any other questions around medical device security?
I have a statement. So you don't have to just look at the replacing of the medical device. One of the last projects I implemented when I was in a hospital as a CIO was we did upgrade a system, and with its latest software, it came out of the box with 240 vulnerabilities. It accounted for a large portion of our vulnerabilities, and the vendor had no resolution or nothing they could do to improve that. And it was based on old versions of software. They were using database software and interface engine software. So you have to, I believe Kelly said, you have to look and do an assessment when you implement a new technology to make sure you're not introducing new vulnerabilities. And to have 240 in a new installation is just, it's not acceptable.
Yeah, absolutely, Jonathan. Thanks for sharing that. Okay, the next big topic where we got several questions was around resource allocation and just in general focusing on cybersecurity. This first one specifically is around the expense that it takes to implement a cybersecurity stack. How do you know which ones you should implement versus others if you only have a certain amount of money to spend? Which solutions would give you the most bang for your buck? So I'll kind of throw that out to the panel to give some thoughts on that.
Well, if you don't mind, I'll jump in and then let the rest of the panel take over. When I came here to Lake Regional, I came here from a different facility I'd been at for 20 years. So one of the first things we had to do was a full assessment, infrastructure, cybersecurity applications, you name it. What I found very helpful on the cybersecurity side of things was implementing NIST, CSF, and doing the C2M2 assessment, which helps me prioritize, the spend, where I'm going to get the best bang for my buck. You don't always agree with the tool and with the, what NIST is telling you, but it does give you a good foundation. And then you have to get the basics first, get the basics under control and then worry about the, the bells and whistles that you can come along with later.
Laura, I would agree with what Patrick was just sharing. You've got to understand the basics and start at that point. And, you also will want to sit down after you have these assessments and you understand NIST, CSF, and you know where you're trying to go. You want to sit down and create a cybersecurity strategic plan. And build a budget around that, not just for the next fiscal year, but for year 1, 2, and 3, because it might take 2 years, 3 years to implement tools, but understand what the tools are that you need to address the gaps that you have. And don't look at, well, what can I just buy a bunch of cheap stuff because I can afford it, and it may not address your need. Know what those needs are and prioritize them, and then go after them in a methodical way. at the same time educating your senior leadership, your CEO, your CFO, the board. All of those people need to understand the importance of why spending dollars, because all of us who've been in not-for-profit hospitals or even for-profits, every dollar has a name, and we just have to make the case that there's some dollars that need the name cybersecurity on them, but that comes with a plan. So I would encourage people to specify what it is they need and look at a 3-year plan and create a strategic plan around that.
Thanks, Guy. Kelly, I know you work with clients every day on their strategic plans and identifying kind of what they can do next. Do you have anything to share around that?
I think we are, kind of touched on it already. I think it's a matter of, I guess, bringing awareness to people, and really thinking about it from a perspective of what, I guess, aligning your strategy with your business objectives. Really, it's just making sure that you illustrate kind of the benefits around having having a cybersecurity strategy, and who's going to be involved. Also, maybe just presenting and really having a better understanding of current threat landscape and identifying those risks and potential investments. So making sure that, if you're thinking about the type of risks that or impacts that it could have on your environment, what's the potential financial impact of not having the cybersecurity strategy, as well as the cybersecurity tools that an organization is going to need. So you think about the potential of, the cost of a potential breach, and presenting kind of that cybersecurity investment and the strategy around what are the, you're always trying to, increase your defensibility and decrease the financial risk. So just some of those things to consider.
Okay, thank you. This next question is a little bit more specific. They were asking about, they've typically used open source tools, and especially going forward for cybersecurity and auditing and meeting some of the cybersecurity requirements. Some of the tools they've been buying have been closed sourced. So they're wondering which is better, and is there a reason to go for open source versus closed? Thinking of the incidents of compromise from third-party vendors.
Laura, I would just say, first of all, because it's open source is not a problem if it's, again, a solid solution that meets the need. However, I would be concerned if an organization is resistant to use a solution because they have to pay for licensing, whether it's because it's been acquired or something like that. If we're trying to protect our organization, I go back to what I said earlier. We need to identify those solutions that strengthen us and that close these gaps. And if you're looking at, well, if I can do a little bit of this and a little bit of that and not have to pay anything, you're probably not going to be in a good place at the end of the day. I'm not in that. Look, I never had the money to throw it around for any and everything, but you've got to do your homework and be very specific about what it is you need. And if you're going to put in a solution and spend that time to implement something, make sure it's the right solution, whether it's open source or not. Doesn't matter, but don't let the fact that you're having to pay a license keep you from using the right tool at the right time.
Yeah, I agree with you. I'll give you an example. When I came here, they were doing DNS filtering, but the DNS filtering solution they were using was, not really commercial grade, if you would. So it wasn't truly protecting the system. But by spending money, to go to a solution we did here with Cisco DNS, we really have a true umbrella, if you would, over our web and internet traffic. Those are things you have to understand the risks that you're taking, using the different systems when you're evaluating them. Going cheap sometimes is not the way to do it is on cybersecurity, just from my perspective.
Thanks, Patrick. The next couple of questions are very similar around challenges with resources. A top concern, of course, is trying to stop cyber criminals. And the concern is having resources at your facility to be proactive and identify if those are happening. Any recommendations other than what's been shared to overcome that? Lack of resources, lack of funding, too many competing priorities.
Well, I'm going to toss a slow ball pitch to Kelly, but I will say this, because now there is a space where you can outsource a lot of this, because sometimes it's not just because you don't have the budget to hire a full-time employee, an FTE, it's because you don't have the proper trained person to put in a position if you create it. But I look at our CTOC, I look at others, I'll be vanilla, we're not the only ones, but you can consider outsourcing those, and I'm not the best one to speak to that, but Kelly is.
Well, yeah, I mean, as far as what we do, our team is doing that monitoring. So a lot of the organizations that we have worked with that have implemented and have our services and solutions, they find it beneficial because, we are 24/7. So it is that eyes on glass that somebody's always monitoring and watching and working with your teams to notify you if there is something that is occurring within your environment. So, I mean, there is that outsourcing component of it that I, would say that has worked very well, because then you're getting that manpower, you're getting, the benefit of somebody working with you to, run your vulnerability scans, having, the look of monitoring the current threat landscape and providing that additional insight as to, what is happening in the world right now. So there is definitely, I would say, it's advantageous to have, you can, outsource to make sure that you're supplementing potentially where you're have a deficit with the resources that you have in your organization.
And I'll just add to it, I think a hybrid approach for many of us is the right approach. Having a CTOC do the monitoring and keeping you informed of things that are going on both on your network and then national or globally is very important, but also having your staff aware that you can pick up the phone and call Cisco TAC. You can pick up the phone and call your virus ABC support, and make sure you keep those support contracts in place as well. Because if you lose support, you lose the ability to keep your security solutions up to date. So, kind of what I mean by hybrid support, there are things that you have to do that a CTOC doesn't necessarily do for you. So.
Yeah, thanks, Patrick. And here it says, any tips for budget-friendly ways to? Don't underestimate the importance of education. So all of the educational materials that we're presenting to you monthly, share those with your teams. And we have lots of other documentation and policies and procedures and things that are at your disposal. So feel free to utilize that, and let us know too if there are certain topics of interest that you would like to see in the future that would be helpful for not just you, but your teams as well.
So I'll tag onto that too, Laura, as far as like internal communication. So, I mean, there's ways to share internal information. So I know that I always advocate with my team. It's like, if you see something, obviously let the entire team know. So there's a benefit of education within your own organization. So even if you were to establish something internal within your environment that, if you guys utilize Teams or you have some sort of lunch and learns around, awareness and education is kind of that budget-friendly way to spread the news of what is happening, current threat landscape, getting people involved, really having them understand what their impact is from an organizational standpoint around your whole cybersecurity awareness program, and that they are obviously an important piece of it as well. So I think that's just another kind of budget-friendly way, is to offer internal education sessions or chats or however you use it, from Teams or Lunch and Learns.
Absolutely. Any other questions from the audience for the panel on this? Okay. And the next topic is a little bit similar to some of the things we've already talked about, but it's how to get leadership and other departments in your organization involved in cybersecurity. Often in the past, it was thought that cybersecurity was just an IT problem, and obviously a lot of us on the call know that's not the case. But you know, it's a struggle with manpower, but also struggling to get other areas of the organization to understand it's not just an IT issue. And I think a lot of it goes back to what Kelly just said about education, but I'll open it up to the panel to weigh in.
Well, I'd weigh in on that first bullet. This goes back to what Guy was talking about, creating a strategic plan, and not so strategic that people can't see what's within the plan. You have to have a plan before you go to your senior team. Don't go to them and ask them to help you create the plan. They may advise you once you get it to them. Same thing with your board. You've got to actively engage your board because once the board understands what this can do to the operations, the business continuity of the organization, then they'll start top down, right? And then you feed from the bottom up. I don't know if you have anything to add to that.
I would say I agree completely, Patrick, with what you were sharing. And I would say that as we're communicating with senior leadership, first of all, if you're a senior IT person, CIO, CISO, IT director, whatever that may be, you're the top responsible person. You should develop a relationship with your CEO or CFO, not to hound them every day to ask for money or things, but just to understand so they know that that you're part of the team. At the same time, the hardest thing I had to learn how to do is to talk a lingo that was not technical. I had to learn how to say technical things in a normal way. And that's not always easy to do. And if you start talking about NIST 853 control families and all like that to your CEO, in 3 seconds, they're going to glass over. And in 5 seconds, they've shut you down. So you've got to be able to articulate the needs of the organization in a way that your audience listens to them. So building relationships, that's the key.
Okay, thanks, Guy. And what about for the rest of the organization, that problem of that's not just an IT department problem, getting them to understand that everyone has a stake in cybersecurity?
You know, if you can establish a cybersecurity council, governance council, and bring in those other departments, those department heads, physician leadership, and ask them to come to the table with IT, then you know you're bringing them into the loop, right? And there are so many examples of just bad things that have happened. You know, you don't have to go in and, like Guy was saying, talk to tech. You just say, hey, look up the road. Look what happened to those guys. We don't want to be those guys. And then here are the ways that we can go about protecting ourselves. And a lot of times, less is more when it comes to what you're trying to communicate. So.
And Patrick, to that point, I would say, and I saw in the chat where someone asked about who you would include on these on a cybersecurity council, but you certainly want your lead physician that's either the champion with IT or the CMIO or whatever role you may have. you want a physician engaged that understands, because look, the more we tighten and protect, the odds are the more impact it's going to have on users. That's the world we live in. But a physician or clinical, I would include nursing as well on this council. They need to understand that it's better. This is a better alternative than a 4 to 6 week downtime because you've lost all of your infrastructure and your servers to ransomware or something like that. But engaging your physician community through the right people, engaging your nursing community through the right people, making sure that those people who make purchasing decisions understand that they're all part of this. This is a community that protects the organization, and you know, the more the merrier may be the right approach for something like this. You don't want someone making a decision that could impact your cybersecurity landscape in your organization that's not part of this team. So include your clinicians, include your ancillary representatives, include people that are going to be impacted by the decisions made to strengthen your cybersecurity position.
Yeah, that's a great idea. I like that. Okay, so does anyone have any other questions on other cybersecurity topics that they want to throw out for the panel? Any other challenges, things you're considering for 2024, areas of focus? Okay. Then I will go to I just wanted to bring up a couple of items for going forward with the Cybersecurity Insider Program. Just wanted to let you know that we will have no live webinar in December, and we think this would be a great opportunity for you to go back and revisit any of those webinars that you missed. And those are all on the private YouTube channel, and they'll be in the follow-up email as well. Utilize this time to share those with your teams. Go back and review any topics that you may have missed around AI, medical device security, other topics that we covered this year. And just a sneak peek, we've mentioned this a couple times before. We did a survey and some of you gave some feedback for an in-person event in 2024. We're looking to hold a Hacking Healthcare event April 16th through the 18th. We're currently investigating locations. This will be about a 2.5-day event where we will have sessions to help you define strategies for 2024, give you actionable items to bring back to your teams to help train them. It will include a 90-minute tabletop exercise, and this will fulfill your annual requirement. So that's an excellent reason to come on its own. We're looking to have some excellent keynote speakers and some guest speakers as well. And it's really just an opportunity for this group to get together, learn from each other face to face. I know it's not always easy in these forums to learn from each other. So we're hoping to get a lot of you together in person. So stay tuned for that. More details to come. And wishing everyone a happy holiday season as we're coming into December. Any last thoughts, questions for the panel?
Well, I just want to say thank you to everybody, and I appreciate the opportunity to participate.
Thank you, Patrick. We appreciate it.
Yeah, thank you for everybody joining today. And if anybody has any questions, obviously you can reach out to any one of us.
All right, thank you. Thanks, Guy, Kelly, and Patrick.
Have a good one.
Bye-bye.
Bye.